All right, good morning, everyone. Thank you for joining us today for our very first all stakeholder meeting for the year for 2022. So just before we get started, next slide, please. Just a few logistics. Participants are muted during the presentations, so you can use your raise hand icon during the Q&A portion to request your line to be unmuted. Closed captioning is available. You can access it by clicking the icon at the bottom of your Zoom screen. We have the Q&A function available, so you can share your questions and comments using the Q&A icon at the bottom of your Zoom screen. And this presentation and recording will also be archived, and you can visit CDA's YouTube channel to access. Next slide. We'll go ahead and I'll pass it over to our director, Susan Damaris.
Thank you, Connie, and good morning. Welcome to our stakeholders and to the CDA team. I'm happy to be here today for my very first stakeholder meeting as director of the California Department of Aging. It is a high honor and a great responsibility that we have here at CDA to implement record state budget investments made by the governor and the legislature, and to spearhead investments in the American Rescue Plan Act throughout our network. And a great privilege to lead the Master Plan for Aging's 10-year blueprint for California, and so many more activities that you'll be hearing about from our team today. If we go to the next slide, I wanted to be sure everyone is familiar with the department's vision and mission. And before we hear about the great work happening by the CDA team and our community partners throughout the state, I wanted to ground all of us in who we're doing this work for. And as our mission shows, it is for individuals, families, and communities throughout California that we do this work, and that we strive to do better work with your support, guidance, and input. So we look forward to sharing where we are as we start the new year at CDA, and to hearing from you today and in the months to come. I'll turn it over now to our Deputy Director, Mark Beckley.
Oh, good morning, everybody. It is great to be here with you this morning. My name is Mark Beckley, and I'm the Chief Deputy Director for the California Department of Aging. I will be providing, starting off with some updates on some really exciting new hires that we have at CDA, executive hires. The first person I'd like to introduce is Sarah Steenhausen, who's going to be our new Deputy Director of our Division of Aging Policy, Research, and Equity. Sarah comes to us from the SCAN Foundation, where she served as the Director of Policy and Advocacy. And she was also a very instrumental stakeholder in helping us develop the governor's master plan for aging. Later in the presentation, Sarah will be sharing more about her new division. I'm also very happy to announce Blanca Castro as our new State Long-Term Care Ombudsman. Blanca comes to us from ARP, where she served as Advocacy Director, and she succeeds our very long-serving prior State Ombudsman, Joe Rodriguez, who served in the role for the past 19 years. I'd also like to thank Eden Rosales, who's the Deputy Long-Term Care Ombudsman, for serving as acting State Long-Term Care Ombudsman for the 6 months prior to Blanca's appointment. So really happy that Eden was able to step into that role, and she did a phenomenal job as our acting State Long-Term Care Ombudsman. And then finally, I'd like to introduce Susan Rodriguez, who is our new Office of the Long-Term Care Patient Representative Assistant Director. This is a new office established at CDA to provide local patient representatives for individuals in long-term care facilities who are incapacitated and unrepresented, and unable to express their own healthcare preferences on hospital interdisciplinary teams. So this is a really critical function that Susan will tell you about later in the presentation. And Susan comes to us with extensive elder justice experience, having served as a long-term care ombudsman coordinator in San Diego County, as well as a deputy public guardian in San Diego as well, and having served as a social worker in a skilled nursing facility. So really glad to have somebody of Susan's extensive experience to fill this important new role for CDA. And I'd also like to note another critical new hire that we have under active recruitment, which is for a new CDA Chief Information Officer. So if you know of anybody who might be suited for this role, please encourage them to apply. We're really building a strong executive team here at CDA, so we'd love to make another stunning new hire in this position. Okay, next slide, please. So Omicron remains at the top of our minds, as it does, I'm sure, on the top of your minds as well. There is some very promising news when it comes to the virus, in that we're starting to see declining COVID case rates as well as test positivity rates. However, we still remain extremely vigilant in our efforts to minimize risk of the virus to vulnerable populations, such as older adults and individuals with disabilities. So as you're well aware, the state masking requirements for indoor visits continues, as well as requirements to either show proof of vaccination or a negative COVID test in long-term care facilities and hospitals, again, depending on which facility we're talking about. So we continue to have these requirements in place for the protection of individuals and residents who are at risk of complications from COVID. I'd also like to note that the state has active efforts underway to secure additional COVID test kits. So we're working collaboratively with CDPH on their work to secure COVID test kits so that we can deploy those to our partners, to our providers, and residents of long-term care facilities. And then I'd also like to note we have a very active and collaborative partnership with our local area agencies on aging to conduct outreach and facilitate visits to vaccination test sites for individuals who are currently unvaccinated. So again, we have really good, strong efforts underway to continue to combat COVID and provide protection for our vulnerable populations. With that, I'll now hand it over to Connie Nakano, our communications officer, to talk about CDA's COVID outreach efforts.
Thanks, Mark. So just wanted to touch a little bit about CDA's vaccination outreach efforts. Next slide, please. Yep. So here's just a quick snapshot of COVID-19 cases and deaths by age. So to the left, you'll see confirmed cases by age in California. You'll see that the 65 plus population takes up about 9%. And then to the right is confirmed deaths. Although it's 9%, you'll see the deaths of 65 plus takes up about 70% of all those. Next slide. So there's still a huge emphasis on making sure this population is vaccinated and boosted. You'll see we have 83% that are fully vaccinated with 2 shots. This doesn't reflect the 3rd booster, but there's still a percentage that remains unvaccinated and unboosted. So our campaign efforts are still promoting that. Next slide. So our campaign effort still includes a lot of the paid and earned media, particularly working with broadcast radio and television, and also ethnic media outlets. We do have some vaccine outreach campaign postcards available. These are all made free and available to any stakeholders and partners that could find these useful. They're already pre-printed. There's just no postage included with it. So you can either mail these postcards or you can use them to distribute at events or at your local offices. We have a direct link here if you'd like to order them. We have many cards that you can order. We'll also drop the link in the chat as well. Next slide. And of course, you can find out more information about our outreach efforts on our website. We'll have a direct link to that as well. You can see the zip codes that we're targeting, to the media plan, the different media approaches that we're using, and also another link to the direct mail pieces as well. Next slide. Now I'll hand it off to Thomas Cameron for the governor's budget proposals.
Hello, everyone, and thank you, Connie. My name is Thomas Cameron. I'm the Deputy Director for Administration here with the Department of Aging. Next slide, please. So I'm going to go over today the investments that were made in the governor's proposed budget released in January, specific to the Department of Aging. One note I want to make before moving through these proposals is what I'm going to present here today are the investments provided directly to CDA and do not represent any additional investments in aging services programs and other master plan for aging initiatives funded outside of our department with any of our partners, such as Department of Healthcare Services, Public Health, and so on. So I just wanted to make sure I framed that for you before I got into our actual investments. The first one and the most significant investment is resources that were provided for the master plan for aging continued implementation, or phase 2. This represents approximately $2 million starting in 2022-23 and $1.9 million starting in fiscal year 23-24 and ongoing. And these funds support 12 new positions within the department, and they focus on various different categories, including helping us to establish our first ever data and research team, our equity team build out, including a new chief equity officer and a tribal liaison, additional policy leadership, some additional resources for public, external, and stakeholder communications and engagement efforts, and also a brand new function here at the department, if approved, will be the state public guardian liaison. A link to this proposal and all proposals will be at the bottom of each slide. So you'll be able to click that and read through the individual proposals once this is posted publicly. Next slide, please. So the next investment is a smaller investment to continue to support the department's administrative workload. We've seen a lot of increases in staffing and in administrative workload over the past 2 budget cycles. And this proposal provides an additional $536,000 in fiscal year 2022-23 and an additional $512,000 beginning in 23-24 and ongoing to support 4 new administrative positions, focusing on our human resources team and providing our business services some additional leadership support. And business services refers to our procurement, contracts, facilities, and other administrative operations. Again, a link is provided in the slide. And our last proposal is a technical adjustment to our what is referred to as position authority. And this is a zero cost proposal to provide the department with additional authorized positions for 8 existing resources and employees that we have working already, so we can convert them to permanent and ensure that our staffing and budget align more accurately. And again, the link is included on the slide. And if you have any questions, next slide, please. My contact information is listed here. Please feel free to email me with any additional questions on the investments that I just went over. Thank you, and I will hand it off to my counterpart, Sutep.
Thank you, Thomas. Sutep Lovnich. I'm the Deputy Director for Programs here at CDA. I have the opportunity to share all the wonderful work that our Aging and Disability Network have accomplished in 2021 and highlight the key ongoing and upcoming activities in this new year. So next slide, please. First, our largest investment is in nutrition efforts to reduce food insecurity for older adults. So there have been many investments in food security across the state and across populations, particularly this past year. And we're getting additional resources to support our efforts to strengthen the infrastructure and increase meals served to older adults this year. Next slide, please. And then I also wanted to hit on, we have expansions in digital divide and digital literacy aimed at supporting our community to access and engage in resources that are available online. Of course, while online resources can help reduce barriers, we need to address many of the gaps in accessing and navigating those resources online. As a department started in 2020 with donated smart home speakers, 2021 with connected iPad devices, and now in 2022, we have additional investments for CDA to expand, work with our county partners and departmental partners in digital literacy and broadband access efforts across the state. So more exciting work to come. Next slide, please. The next couple of slides highlight many of the various efforts across CDA's programs, and a really big shout out to our CDA team and our partners that are carrying forth this important work. Just under supported services, we highlight a few updates here and expansion efforts, falls prevention, the friendship hotline, the senior community service employment program. So additional investments and expansions in those programs, and not listed here, I'll plug that we're building up the breadth and expansion here at CDA and across the state in elder justice, senior legal services, behavioral health, Alzheimer's, dementia, and family caregiving. So more to come this year. So that was a mouthful. I will jump to the next slide, please. And in our Medicare and long-term care and long-term supports and services navigation efforts here at CDA, HiCap continues to serve individuals navigating Medicare enrollment, most recently in this past enrollment cycle. And now in 2022, HiCap is looking at opportunities for modernization efforts, building off the HiCap modernization report supported by the SCAN Foundation last year. This report is here. The link is online and available, and CDA is considering near-term and longer-term HiCap modernization efforts and investments to come this year. And next slide, please. Next slide is about our aging and disability resource connections that are partnerships between our area agencies on aging and our independent living centers that continue to expand across the state. Now with ADRC partnerships covering over half of the state population, the ADRC network is receiving increasing ongoing state investments, one-time investments, and to build and strengthen the capacity of the ADRC network that you see here. So really exciting work in the ADRC space as well. And then one more slide, next slide. I'll touch on right at the beginning of this year, the state received approval from the Federal Centers for Medicare and Medicaid Services on CalAIM and waiver renewals. So that positively supports the programs that CDA administers for the state Medicaid agency, which is Department of Healthcare Services. CBAS sites received allowability for emergency remote services that allows for specific remote services for specific emergency conditions. And CBAS sites are continuing to work with CDA, public health, and our health care services to fully reopen sites for in-person services this year. Within MSSP, our multi-purpose senior services program, the beginning of this year also received the restoration of waiver slots, which is accounting for about 25% increase in slots from the program. And there's expansion in coverage for MSSP in El Dorado County. And across the state, MSSP is one of the programs launching the electronic visit verification effort, which is now a federal requirement. So that is a little summary of all the important and hard work that continues here at CDA and with our partners in California. And with that, I will hand that over to our updates with my colleague Blanca.
Good afternoon, or good morning rather. I'm Blanca Castro, and it is my honor and privilege to be representing the State Long-Term Care Ombudsman Program. And just a reminder, this program has been in existence since 1978. So we're well over 40 years in existence. Next slide. And the unique role that the Ombudsman representatives have is that during the pandemic, it really demonstrated the essential role that they play and that they have with representing residents in long-term care facilities. Next slide. Reminding everyone that in California, not only are there a little over 1,200 skilled nursing facilities, but we have 7,505 residential care facilities for the elderly. And the long-term care ombudsman representatives across the state go into these facilities, and they are working with they're working with clients or residents, they're working with their families, and they investigate any complaints to determine whether or not there has been any compromise with their health, with their basic rights. And they do this to the completion of the case, but to make sure that it's to the satisfaction of residents. Unfortunately, this last year in 2020, what we're showing you here is the National Ombudsman Reporting System data. We had 40,178 total complaints that we received. That has been an increase of 37% since 2020. And so, excuse me, this was 2021. Next slide. What we also are noticing is that, and we were able to complete 15,204 skilled nursing facility complaints, and of those, another 30,480 residential care facilities for the elderly. What I wanted to point out is that the top complaints that we are seeing are around abuse, neglect, and exploitation. And when we talk about these three categories, this can include sexual, physical, psychological, financial, and neglect. We had about 10,568 total complaints in 2021. And then under the category of care, so this has to do with if somebody falls, we had 10,165, and it's unexplainable, or the response to somebody's request for assistance, accessing or getting, having access to assistive devices or equipment, or symptoms that are left unattended, and medications and care planning. And then also on top of this is personal hygiene. Are people having baths? Are they being taken to the restroom when they have their call button? And these are the kinds of complaints that we have seen in these two categories significantly increase. Next slide. So the boots on the ground, and as I said, the essential representatives, and they became essential workforce because while surveyors and family and visitors were unable to go into facilities, the ombudsman were able to go in. We have 80% of our representatives are volunteers. We have 236 local certified paid staff. But looking at this map, you see that there's quite a large expansion of where they go and they visit. So while we haven't been able to go in and do as many visits as we would like, we have continued to investigate complaints, not just virtually, but actually going in. So the PPE was very important. And also what has been very important have been the boosters that have recently been available to volunteers and staff. Next slide. So what are some of the challenges? And we've been meeting, I'm here already for a month, but we've already had a couple of meetings with all of the coordinators across California. And the number one challenge that they're having is access to the COVID-19 tests. So there's a requirement that ombudsman representatives must have every week a test to make sure that they're, even if they're asymptomatic, but that they're not positive, they're not COVID positive. So we are working with our state partners to try and get tests, the rapid tests, to the ombudsman and their representatives. But we have been working with the State Department to be able to, Department of Social Services, Office of Emergency Services, and of course, entire CDA to try to issue tests to residents. And we'll have more information about that later on in this presentation. The other real challenge has been that there's a disconnection. We have orders from Centers for Disease Control. We have orders from the Department of Public Health. And then we have local public health orders. And there had there has created quite a bit of confusion around just how long, if you are exposed to COVID and you're not symptomatic and you're boosted, or you have the 2 vaccines, or one if it's Johnson & Johnson, how long do you have to, the word is escaping me right now, how long do you have to quarantine? And that has been a challenge because we went from 14 days to now 5 days. So we're just trying to, and working with our partners across the agency to really minimize the confusion, but more importantly, ensure that ombudsmen and surveyors are exempt from this so that they can continue to do the work that they're doing. And then lastly, we've heard from the field that there are a lot of facilities that have just locked the facilities and are preventing ombudsman representatives from entering. We are protected by the federal and state regulations that ombudsmen are protected to go in and to do the work. And this is something that facilities can be fined. And so whenever anybody hears about that, we want those complaints to come to us because we do need to escalate them and we need to take immediate action. Next slide. So for 2022, there are a couple of things, there are a few items that we want to just cover. We have not been able to do on-site monitoring, and that's one of the roles of the state long-term care ombudsman team. So we are going to begin doing traveling across the state and doing on-site monitoring with the local ombudsman program, providing technical assistance and support. We are still planning in May, which is Older Americans Month, one of the 2 conferences that the state ombudsman office is required and does organize for all of the state or the local coordinators. The theme this year is, we're using it from the National Older Americans Act, is called Age My Way. And the specific dates and details will be available. And if in person, we'll definitely be doing that. The other thing that we've embarked on is, and we've heard from many local coordinators, that they want to have uniform training across the state. Many of them have been developing their own training, whether it's basic certification training, how to investigate an adult protective or elder abuse case, any kinds of changes to policy, whether it's federal or state. But being able to have uniform training is only going to make it more effective, so that regardless of where you live in California, you will get the same level of assistance from all of the ombudsman representatives. And increasing the funding. We're really grateful for the focus that Governor Newsom has put into older Americans in California. And certainly the ombudsman program does need to have more funding to help the local program staff up. In the previous slides, I showed you that there's about 400 volunteers. That's down about 300 from the previous years. One of the challenges, many of them are older adults and we're not comfortable going into facilities, especially with the risks of COVID. So really wanting to support the local programs so that they could perhaps hire a full-time equivalent to do volunteer recruitment, volunteer training, and then other staff to help with the field visits. And then a couple of last items I want to touch on is that on the outreach and education, we need to really emphasize with our local partners, but most importantly with residents. We want them and their families to know what long-term care ombudsman representatives can do, the voice that we can bring to residents if their civil rights are being violated. And through that, what we're doing is we're also focusing on some advocacy efforts that have currently been introduced. One of them is Assembly Bill 895 by Assemblymember Holden. We are supporting this bill. That's, as you probably all know, is the long-term care ombudsman is able to take positions on bills that not necessarily have been taken by the Department of Aging. So we do have an independent voice in that regard. AB 895 would require long-term care facilities that upon admission to a long-term care facility, residents would be given the information about what an ombudsman representative does and the local contact information for their long-term care ombudsman, as well as the crisis line. AB 1502 by Murasuchi. That bill is one that was introduced last year, but it was held over as a 2-year. We're supporting this. This bill would close some of the loopholes currently when there is a change of ownership or there's a transfer of ownership from one operator who may want to transfer it to someone else. And this bill would require that when there's a transfer of ownership, that operator must go through the entire application process. We want to make sure that they're qualified and that they have to go through all the background checks, et cetera, and for the benefit of making sure who's running long-term care facilities in our state. The last item, and it is really exciting to be part of the Elder and Disability Justice Coordinating Council. I mentioned that because right now, Adult Protective Services Ombudsman, now we have the Office of Long-Term Care Patient Representative. There are a number of different areas where even within the state, we need to coordinate how anybody could report elder and disability abuse cases, and that it would go through a process that all of the parties that touch this case are coordinating their efforts, from law enforcement to the courts, to social workers, to facilities, the list goes on. So with that, I'm going to turn it over to my next colleague, and I've left my next slide, the contact information that you can send any emails. I didn't put my personal because I will receive these if it goes to the general state ombudsman email, and then we determine who the best individual would be to respond to the questions. Thank you very much. Susan?
Thanks, Blanca. Hi, my name is Susan Rodriguez, and I am the Assistant Director for the Office of the Long-Term Care Patient Representative Program. As Mark Beckley mentioned in the beginning of the presentation, this is a new office. I've been in this role for about 3 weeks, and I am honored to be in this role, and I am so excited to set this important program up. Next slide, please. By way of history, the establishment of this office is a result of a Health and Safety Code 1418.8, which sets forth procedures for skilled nursing facility residents and intermediate care facility residents who are unable to make their own decisions, that they have somebody that they are represented at an interdisciplinary team, and that way that their care needs can be reviewed and medical authorization can be made. This statute was challenged by the California Advocates for Nursing Home Reform. And as a result of this, the court required facilities to make sure that a patient representative is part of every interdisciplinary team meeting. And this is somebody from outside of the facility, which involves the creation of this office. Next slide, please. Some of the responsibilities of the office at the state level is to develop and maintain policies and procedures to implement the program. And we're trying to develop a statewide approach to represent the interests of otherwise underrepresented residents. And we are currently working on these policies and procedures now. Some of the other things that we're moving forward as and part of our responsibility is to train local providers. And then we will also be providing technical assistance to local providers as well as to facilities. As Blanca mentioned, we will be working with her office as well. And ultimately, we'll be providing the oversight and the monitoring for the program compliance. Part of what we're doing right now is trying to see what types of providers might want to do this at the local level. We're looking at either regional providers, or if there's an organization that would want to provide it at a statewide level, that would work too. Some of the responsibilities of the local patient representative will be, they will be the ones actually participating in these meetings to represent the preferences of the residents. And these preferences will be represented by way of doing in-person interviews, review of medical records, and if there's any family or friends that can help provide this information to the long-term care patient representative. The goal for implementation is July 2022. This is an ambitious date that we're working very hard to achieve. I'm very fortunate to have a great team here at CDA that's supporting me, and I'm looking forward to standing this program up. Thank you very much. I will turn it over to Sarah Steenhausen.
Great. Thank you so much, Susan. It is such an honor to be here with all of you to talk about the launch of the Division of Aging Policy, Research, and Equity. Next slide, please. So I wanted to talk a bit about what the focus of this new division is and what it means for our program and service providers, for consumers, for other state departments, and of course, for the Department of Aging. The key objective of this department will be to focus on advancing the policy work, the research, and infuse all of it with equity lens that is in alignment with the master plan for aging. So we're super excited to have resources to build out a team focused on these initiatives so that we can partner internally with our colleagues throughout the programs at Department of Aging, but also, and so importantly, to partner with all of you in the community and with our other state department and other agency representatives so that we can begin to tackle the issues that impact how people age in California. So our focus will really be on applying an equity lens that elevates the voice of older adults, people with disabilities, and caregivers across programs, policy, and research efforts. We really want to be in alignment with the California Health and Human Services Agency's efforts to focus on person-centered, data-driven outcomes. And that's where the role of policy and research comes. And certainly focusing in on equity throughout it all. So we will be convening our partner agencies as well as internally our own staff to talk about the different policy issues that need to be addressed, but really look forward to partnering with our stakeholders as well. We want to listen, we want to learn, and we want to engage all of you. Next slide, please. So our next steps are first and foremost building our team. So please be on the lookout for announcements for tremendous opportunities to be part of this really exciting effort. I'd say that our focus is going to be hiring our equity team, our research team, and the policy team. But at the same time, what's super exciting is that we also have an opportunity to be leading on the implementation of the direct care workforce initiative that CDA is heading up. This is for the non-IHSS portion of the training and stipends that will be issued to the service delivery system. And we're developing our plan for that in the months ahead and look forward to partnering with all of you on that. So more to come, and please reach out to me if you have feedback, thoughts, and questions. Really excited to partner with all of you and look forward to our next steps. So I will turn it over now to the next slide. And I would love to introduce Amanda Lawrence, who is our amazing director of the Master Plan for Aging and is really a key partner in all of our efforts in the DAPRI division. So Amanda, take it away.
Good morning, everyone. I'm very pleased to be here to share a few updates related to the Master Plan for Aging, which is the administration's blueprint for building an age-friendly California. Next slide, please. So since I've last been here to share updates with you, the master plan has turned 1. We celebrated 1 year of implementation just a couple Fridays ago. We did this with an anniversary summit. Governor Gavin Newsom provided opening remarks via video. And then we also were joined by cabinet secretaries from Housing, Health and Human Services, and Labor, as well as many key stakeholders and legislative leaders who shared their reflections on the progress we've made thus far, and also looking ahead regarding what we plan to do over the next year to continue to advance the Master Plan for Aging. You can watch this whole event if you missed it. It's online, posted to our Cal HHS MPA page. Next slide. And of course, we launched on that day, or released, our Master Plan for Aging's first annual progress report. This report outlines the progress we have made over that first year of implementation across all 5 goals, as well as some highlights related to local implementation. We've also included our 2021 legislative wins. We really want to highlight and make sure that everyone understands how important what the legislature is doing is to advancing the master plan and ensuring that we actually reach our 5 bold goals. All of the reports and materials are available at the mpa.ca.gov webpage. Next slide, please. So at our summit, we launched our Together We Engage 2022 event calendar. We plan over the next year to gather input from the public and from stakeholders and from our partners to inform the next 2 years' initiatives. So we identified 132 initiatives for the first 2 years of the master plan for implementation. We're already thinking about the years to come. So over the next year, we're going to be hosting a monthly webinar series, the Webinar Wednesdays, which you may have attended in the past. There'll be one each month for the rest of the year. We're also going to host regional town halls and legislative roundtables and many more events. We really want to ensure through this engagement campaign that we hear from new voices, that we really expand our circle of support, and we really identify the most pressing needs and priorities for moving this plan forward. On the next slide, you'll see our list of webinars for the upcoming year. We have we're covering a broad array of topics such as the no wrong door system, nursing homes, data and equity, caregiving, Alzheimer's. So we will be sharing the registration for these webinars in just a few days on our website. So you can go ahead and register in advance and get those on your calendars. And if you missed just last week, we hosted actually I think it was earlier this week, a direct care workforce webinar where we had partners from California Health and Human Services and the Labor and Workforce Development Agency describe the recent investments that are made into advancing a direct care workforce in California. It will be posted on our YouTube channel, and our slides are actually on our homepage from that webinar. A fantastic resource if you want to learn more about how California is going about strengthening our direct care workforce. Next slide, please. So many things going on many fronts related to advancing the master plan for aging. I just want to call out a few things that are open for your involvement. The California Elder and Disability Justice Coordinating Council launched on January 28th. So last Friday, we brought together 22 stakeholders from across the state and state representatives to discuss priorities, council structure, and really our plans for the next year around how can we together build out a statewide system or network that is truly responsive to elder and disability justice issues. We'll be forming a couple work groups, but we'll be meeting quarterly publicly. Anyone is welcome to attend those meetings and provide public comment. The California Health and Human Services Disability and Aging Community Living Advisory Committee, it's a mouthful, continues to meet and advise the state on issues related to community living. This meeting that we have coming up just next Wednesday, we'll talk about transportation, we'll talk about CalAIM, we'll talk a little bit about housing. So you're all welcome to attend that as well. And then the Alzheimer's Disease and Related Disorders Advisory Committee also continues to meet quarterly to advise the administration on how to be prepared for and respond to Alzheimer's disease and related dementias. Next slide, please. And furthermore, of course, accountability and oversight is key to the success of the master plan. The Impact Stakeholder Committee continues to meet and help support the master plan for aging in reaching its goals. The Equity and Aging Advisory Committee next meets in March. That committee is key to ensuring that all the work we do on the MPA as well as at CDA has an equity lens applied to it. So everything is equity focused and inclusive. The Data Dashboard for Aging. We continually update the data dashboard for aging. It now includes SOGI, which are sexual orientation and gender identity demographics. We have new indicators for unintentional falls, for income security and poverty, as well as internet access, and so much more. We're adding more indicators very soon for disability status, unmet needs for long-term services and supports, caregiving, and more. We are also launching a California Aging and Disability Research Partnership. This was one of the initiatives in the Master Plan for Aging. And this initiative called for California to facilitate a nation-leading research partnership on aging with California's universities. The priorities of this partnership are going to be to advance age and disability-focused research, to strengthen that evidence base for promoting equitable opportunities for Californians to thrive as we age, to provide input on key indicators and data sources to inform the MPA's outcomes reports and our data dashboard for aging, and also to just model a research partnership between state government and academic institutions that are focused on using data for action and equity. It's a partnership that we hope can be replicated across other person-centered data-driven priorities at California Health and Human Services. We are going to announce that membership in the meetings within the next couple of weeks, and this group will meet quarterly, and work groups will of course be advancing the work between those meetings on an as-needed basis. And of course, we released that annual progress report that I just shared. Next slide, please. Local partnerships continue to drive really the master plan for aging. Local playbook events continue to be hosted across California. Local communities are actually developing their own master plans for aging. And we've recently become involved with a partnership with the SCAN Foundation to provide support to develop 3 master plans for aging in rural regions. And then we will, of course, have our town halls and legislative roundtables hosted across California. Those are my quick updates for the master plan for aging. Next slide. If you want more information, you want to stay updated, sign up for our website or our newsletter, and visit our website to download all of our materials. I'm going to pass it back to Connie. Thank you, everyone.
Thank you, Amanda. So now we're going to move to our question and answer section. So if you'd like to ask a question, you can click on your raise hand icon to request your line to be unmuted. If you're dialing in, press *9 to raise your hand. You can also use the Q&A icon at the bottom of your screen to submit a question or comment. We already did get a couple questions in, and I believe we had already answered them, so you could check out the Q&A post on the board as well. You may also email your question to communications@aging.ca.gov after this if you think of something afterward. So I'll give it a minute and see if anybody would like to raise their hand so that we can open up your line, or if you'd like to type in a question in the chat, please do so. We just got a question coming in through the Q&A. Sarah, this will go to you. We have a question about how do you envision DAPRI will engage and work closely with the Equity and Aging Advisory Committee?
Great. Thank you so much. And I saw that question from you, Rigo Saborio. It's great to see you online here. I hope you're doing well. It's a wonderful question. And I think what's exciting is all of the work of these different groups, including the Equity and Aging Advisory Committee, will be critical in informing DAPRI's work. So when we are able to bring on our Chief Equity Officer, we envision that individual will play a really key role in setting that agenda, in engaging in the content, and that we hope that the work of the Equity and Aging Advisory Committee really helps push our work forward and focuses everything in an equity lens across all policy and research efforts. So look forward to working with you in the months ahead.
Thank you, Sarah. And thank you, Rigo, for that question. Again, if you'd like to ask a question, you can either enter it into the Q&A that you see at the bottom of your screen, or if you'd like to ask it live, just click on your raise hand icon and we will unmute your lines. Oh, let's see, it looks like Tatiana, you have raised your hand. We'll unmute your line.
Yes, hi. Can you hear me all right?
Yep, we can hear you.
Perfect. Yes, I had asked the question regarding the new patient representative in that new role at facilities. From a HICAP perspective, I find that there is still a big gap in who can assist a resident of either a long-term care facility or an assisted living facility in decision-making with reference to their medical coverage and other issues, Social Security notification, if they have no family member and they do have dementia.
Thank you for that comment, Tatiana. It's very helpful to provide these comments. Susan, I don't know if you have any comments on that comment that Tatiana had just brought up, or?
No, thank you, Tatiana, for the comment. And there definitely are challenges within facilities for people getting those kind of services and assistance with the financial part that you had asked about before too. So yeah, like Connie said, we appreciate the feedback.
Thanks, Susan. And thank you, Tatiana, for the feedback. And we encourage feedback from everybody, from all stakeholders. If there's ever any feedback that you think of, if you don't get a chance to mention it at our stakeholders meeting, feel free to email communications@aging.ca.gov, and we'll be sure to forward that feedback to the appropriate division as well. So we have, let's see, another question. Who is the best contact at Department of Aging if we have questions on the local playbook? Amanda, should we have them contact?
Yes, absolutely.
Engage?
Engage at aging.ca.gov is our website to get in touch related to Master Plan for Aging. I would love to hear from you. Thank you.
We'll give it another minute. Oh, another hand raised. Lisa Coleman. We will be unmuting your mic.
Good morning. Sorry,
Okay.
this is an exciting team. I'm just doing the tippy toe dance, hearing everything. But I did have a question. I wanted to follow up with Tatiana. What she's saying is absolutely correct. We are seeing a growing problem with older adults that are unrepresented. I was curious, in the beginning, Thomas mentioned a new position or a funding for a state public conservator, public guardian liaison. Is that perhaps an area we could expand for creating some more of responsible parties, as Tatiana is talking about, someone that can help on the financial side, which is very different than the medical side. So I was very curious about this new position or the resourcing of the position. Thank you.
Thank you, Lisa, for that question. Thomas, do you have any insights to that position?
Connie, I can probably.
Mark? Okay. Mark?
Yeah. Yeah, thank you for that question. And, thank you for bringing up the issue about individuals in long-term care facilities who might need assistance with financial issues or medical coverage issues. That's certainly something we will look at. With the public guardian position, so our primary focus for that position is really going to be talking about guardianships for older adults. But of course, that also entails administrative components as well. So I think as we start meeting with PAPGPC, the association that represents public guardians and administrators, we can have those conversations about, what would it take to expand their scope, to possibly, provide additional coverage. So that can certainly be part of the conversations we have.
Great, thank you, Mark. So we do have another question that popped in the chat. If you have questions, feel free to enter it into the Q&A portion, or you can click on your raise hand icon and we'll unmute your lines to ask your question live. There's a question from Jazz asking, does CDA address concerns with PACE programs? Would that be Mark or Stutep that would be able to answer that?
So what I can say about PACE is that is not one of the programs that CDA oversees. That is housed at DHCS, but we'd be more than happy to provide you with a contact at DHCS to talk about PACE program issues. Obviously, it's a program that serves older adults, so it's something that we continue to be interested in and have discussions with DHCS about. But yeah, we can definitely get you contact information.
Thank you for that, Mark. So one more last call. If you have a question, we have one hand raised. I see Lisa Grodd. We'll unmute your line so you can ask your question live.
Hi, thank you very much. Can you hear me?
Yes, we can hear you.
So as a gerontologist and as a mandated reporter involved heavily with seniors and disability and aging, I'm noticing that there's a large disconnect between now with APS and hoping that there'll be a collaborative piece coming out of the MPA to ensure the safety of some of these seniors that are being exploited and by their family members and or caregivers. And I'm wondering if that's something that's been put into your master plan somewhere.
I can take that.
Ani? Oh, go ahead. Amanda, did you want to take that, please?
We can both provide an answer. Yeah, I
Okay.
just want to, protection from abuse, neglect, and exploitation is a key component or strategy of the master plan for aging. And we did see in the most recent budget that APS received a significant investment in to be used to strengthen it. And the Elder and Disability Justice Coordinating Council that I mentioned earlier is working with APS. We have several APS members and others representing other sectors across California to help to address the issue that you're mentioning. And I'll let Blanca can probably go into more detail about protections.
Thank you, Amanda. So a couple of things. I wanted to first say that there is also a really good question on the chat that I want to address live, but in terms of the coordination, we actually just recently met with Adult Protective Services, their chief, Kim Rutledge, and really glad to say, because we also understand that the ombudsmen are already going into facilities, and so there is definitely a need to coordinate, and they also may need more training, which we know for a fact, on how to do investigations, and then how do they document, how do they make sure that this is a case that then can go to whoever the next reporting entity is. But Adult Protective Services is really expanding, and I can't speak for them, but in the meeting we had, they are expanding their organization internally, and then also just the amount of funding that they have received, because this is now taken on a much more prominent role through the master plan for aging. Even having this Elder and Disability Justice Coordinating Council we are looking at not just the research, but also the equity. And then because there's so many different entities that may touch on the same case, how do we coordinate it so that we are doing this in the most expeditious way and with the least disruption, and also most effective for the person who's been victimized. So that's one level. And then I did want to share my live response to the question for the Ombudsman. How are wanting to know if the data that I made available today, is that public to view? Absolutely. We submitted it to our federal Administration on Community Living, and we will be posting that on the CDA website, where the Ombudsman has a website and there are reports and data, so that will be available and you can view that. And then you also asked for what facilities, as well as the outcome of any investigations, or if an investigation was not conducted, would there be a way to see that online? So the data will show how many are closed, how many are not resolved. So there's a lot more detail that, yes, absolutely, you can look at. And then is there a phone number for Ombudsman to be able to, that is operational? And there is a general crisis line, but you can also contact your local Ombudsman, and all of the Ombudsman in the 35 entities do have their own contact information, but we can also direct you to the right community or county. But the Ombudsman number is 1-888-452-8609, and we can put that on the chat. That is 24/7. We obtain the information, and then it's also routed to the right county. And then if we do have specific requirements as to when a complaint is received, what is the response time that should be handled, and then of course there are ways if there is a particular, if a physical abuse, or depending on the nature of the complaint, we certainly will do immediate intervention. Maybe there's something that could wait a little longer, but we take all of the complaints and we definitely work on each one of them individually. And then some of them, as I mentioned, may be unresolved, and they may not be resolved to the satisfaction of the resident, and that could be a number of reasons. And I think that was it. How does someone obtain assistance from the Ombudsman in regards to filing complaints against facilities for both neglect and care complaints? Again, to call this number, and then we will get you the right person to go and check on the facility, on the resident, and work directly with the resident and family. And if there isn't somebody who, if the resident is not able to communicate, then we'll work with the county to try and get somebody to represent the resident and be able to make those decisions, because we do have to have permission by the resident. That's one of the unique things about the Ombudsman program. It's all based on the wishes of the resident.
Perfect. Thank you for all that information, Blanca. We are up on time, so we appreciate everybody for attending today. I think there was one more question that we did have in the queue, but we'll follow up with that question directly and provide an answer. Can we go to the next slide? All the information, today's recording, a copy of the presentation, you'll find on our website. It'll be posted within the next couple days. If you have any additional questions that you weren't able to ask, feel free to email communications@aging.ca.gov. Thank you everyone for attending today, and we will see you at the next one. Have a good day.